Welcome back. Well, for good reason, we're talking a lot about COVID-19 these days. We want to be safe, but heart attacks still top the list for most deaths in our country and the world. Unfortunately, though, the American Heart Association estimates 80% of them are preventable. Our 9 Health expert, Dr. Payal Kohli, is a cardiologist, and she joins us live this morning to talk about prevention. Good morning, Dr. Kohli. So we hear these words like heart disease, heart attack, stroke. Can you talk about their significance and how they're related to each other?
Yeah, these are really common words, and there's a lot of confusion out there about what they mean. So let's talk about it. So heart disease is caused by a condition called atherosclerosis, which is actually buildup of cholesterol deposits or plaque in the walls of the arteries. Now, where the buildup occurs really determines what type of disease you have. So if it occurs in the blood vessels around the heart, that's called heart disease. If it occurs in the blood vessels in the neck or those in the brain, that's called cerebrovascular disease. And if it occurs in the blood vessels going to the legs, that's called peripheral arterial disease. So the same disease process just occurring in different parts of the body. And what can happen when this cholesterol deposits occur is that the body actually reacts with an inflammatory process. So there's inflammation occurring in the walls of the blood vessel that then causes the cholesterol deposits to actually spill into the artery, and your body reacts by forming a blood clot. So if the blood clot is formed in the heart, it causes a heart attack because it causes lack of oxygen to the heart muscle. If it's formed in the brain, that's a stroke. And if it's formed in the legs, that's called acute limb ischemia.
So there is a silver lining here. AHA saying that 80% of the heart attacks are preventable. So talk about the risk factors for heart disease that are within our control and what we can do to reduce that risk.
Yeah, you're absolutely right. We can change all these processes. And so I have a great mnemonic for this. It's a B, C, D, E. So A stands for alcohol. So you want to keep your drinks to less than 1 drink a day if you're a woman, less than 2 drinks a day if you're a man. It also stands for age, but that's not as much in our control. B stands for blood pressure. You want to keep that blood pressure less than 130/80 because you really don't want the walls of the blood vessels to get damaged. C stands for cholesterol. You want to keep that cholesterol nice and low, the LDL or the bad cholesterol less than 100 because you don't want it to stick to the walls of the arteries. C also stands for cigarettes. So if you're a smoker, you got to quit because that damages the walls of those arteries. D stands for diabetes, but again, that causes damage to the walls of the arteries, making that cholesterol stick. And you want to make sure you don't have prediabetes or diabetes. And then finally, E stands for lack of exercise. So if you want to get at least 30 minutes of moderate intensity exercise 5 times a week. And if you do those 5 things, actually, the American Heart Association estimates you can significantly reduce your risk. Now, there are risk factors like family history or premature menopause and those types of things that are not within our control. But the one thing to keep in mind about risk factors, you can't just do it for a short period of time. It's sort of like a train on a track. You want to change the trajectory ever so slightly because it takes many years to really reap that benefit. And the train will end up in a different destination if you make that change early.
Yeah, it has to be a lifestyle change. So Dr. Kohli, how would I know if I'm at risk and what can I do to reduce my risk?
So the first question is you have to look for risk. You can't, it's not going to come and tap you on the shoulder. So talk to your doctor about your risk factors. Another thing you can do easily from the comfort of your home is go to 9healthcare.org and do their online screening. It takes less than 10 minutes. You put in all your personal information and it gives you a personalized risk score, the risk of you having a heart attack or stroke over the next 30 years. Now keep in mind this is just an estimate and it's based on models, so it's not perfectly accurate, but it gives you a sense whether you're in the low, moderate, or high risk category. And we're considered high risk if we're greater than a 10% risk of having a heart attack or stroke in the next 30 years.
Very important information. Dr. Kohli, thank you so much.